Hi guys, good evening all. So welcome to Easy Nurse Daily Dose for Nursing Students. Today I am going to take the subject as medical surgical nursing. I am deal with this topic as perioperative nursing care. So today we are going to see all the content which is have outlines, introduction, phases of perioperative care, types of surgeries, perioperative assessment, surgical risk factors, perioperative preparation, intraoperative preparation, postoperative care, and postoperative complications. So, one by one, will start for discussion. So, what is mean by perioperative care? So, perioperative care is nothing but it is a term used to describe the entire span of surgery, including what occurs before, during, and after the actual operation. So perioperative means is nothing but during the procedure, before the procedure, and after the procedure, what kind of nursing care has to be given to the patients. That is called the perioperative care. So the perioperative care have a phases. The phases of perioperative have three kind of phases. First one is preoperative care. So preoperative is nothing but begins with the decision of perform surgery and continues until the client has reached the operating areas. So operating area is nothing but it is OT. Okay, before they are entering to the OT, what are the nursing care, what are the preparation has to be done, that is called a perioperative nursing care. Next one is intraoperative nursing care. So it includes the entire duration of the surgical procedure until the patient has transferred to the recovery room. Okay, so in between of the intraoperative nursing care. So the surgical procedure until the transfer to the recovery room, from the OT to the before the postoperative area. So during that time, what are the nursing care has to be done. So that is called the intraoperative nursing care. Next one is postoperative nursing care. It begins the admission to the recovery area and continues until the receive following up evaluation at home or its discharge to the rehabilitation unit. Postoperative care means after the surgery, after we are receiving from the patient in the recovery room to the postoperative bed, from that time onwards to the discharge time, what are the nursing care has to be done. That is called a postoperative nursing care. So these are all the three phases of postoperative care. Next one is types of surgery. So we have a different types of surgery. One is diagnostic surgery, exploratory surgery. Another one is palliative, then cosmetics. So first one is diagnostic, removal and study of tissue to make a diagnosis. So this is all the minor surgeries. So what kind of pathological conditions, or they are going for any biopsy test. So that is a small surgery we need to be do for the perioperative care, either preoperative, intra time, and post also we need to be give a care. Next one is curative. Curative means removal or replacement of defective tissue to restore the function, like a joints, knee replacement surgery or hip replacement surgery. We are removing certain things and we are making some kind of artificial thing to the body. So that is called a curative surgeries. Next one is exploratory surgery. Exploratory surgery means most extensive means to involve exploration of a body or using certain things or using inserted a small insertion, or the example hysteroscopy. Endoscopy. So some of small scopes, cameras which is inserted into the body to visualize the certain things, that is called exploratory surgeries. For that also we have a pre, intra and post nursing care. Next one is we are going to see about the palliative care, palliative surgery, relief of symptoms or enhancement of function without a cure, like a total thyroidectomy they done. So we need to be give a thyroxine tablet for their lifelong. Okay, so palliative means not only for the cancer patient, those who have a full term illness. Okay, those we need a care. So there also we need to be give a certain preoperative or intraoperative case. Then cosmetic cosmetic surgery means correction of defect, improvement of appearance, or changing a physical features. So we are doing some kind of a cosmetic surgeries or any kind of plastic surgeries. So before, after, intra, we need to giving a nursing care. So these are all the types of surgeries. Next one is categories of surgeries. Categories of surgeries means how we are giving, what kind of categories we are going for a preoperative, intraoperative, postoperative care. Urgent, emergency, optional, elective and required. So urgent emergency means we know the patient who comes with the emergency surgeries like any accident or any kind of injuries, okay, some stabbing or some kind of instruments, foreign bodies inside means we need to be making a emergency or urgent surgery. So immediately we need to do the preoperative care. So immediately we are sending to the operation theater, we are giving intraoperative care, and post after the surgery also we need to be giving a care. So that is a urgent or emergency. Optional is nothing but we are giving a certain optional. So today you can do or tomorrow we can make a surgery. It is not an emergency but we can. So like that kind of surgeries are there. Elective surgery means we are planning for the surgery. Like example, hemorrhoids. So the patient is suffering with the hemorrhoids. We are elective. This all kind of elective surgery. Okay, the doctor is planning for hemorrhoidectomy. So this all elective things. The patient is suffering from some kind of conditions, but we are making a some one day for the surgical procedure. Then required is we need for this kind of surgery, we disease condition, we need a surgery. Example, the patient have any heart conditions. Okay, heart condition means like a CABG is required one. For this patient, the heart block is there. Okay, so we need to be go for the CABG. It is a required operation means they have to go for their required surgeries. So these are all the categories of surgeries. Next, now we are going to see about the phases of perioperative care. So definition of preoperative care. The preoperative period runs from the time the patient is admitted to the hospital or surgical center to the time that surgery begins. So here itself they mention when the preoperative periods will be start. The preoperative will be start from the patient when they are admitted to the hospital. From they are admitting in the hospital to the surgery. Okay, for surgery the patient is, example, the patient is came for any surgical procedure like appendectomy. The patient is coming for admission. The doctor gave 20 April surgery time. Okay, the patient is came at 19th itself. Okay, so before that we need to be started with the preoperative assessment. Okay, so preoperative assessment we need to be started with the all the assessment formats, everything we will be started. Then until the patient is reaching to the operation theater, the nurse should be there with the patient and should be take care of a patient. That is called the preoperative nursing care. Here there is a certain purpose of the preoperative care. First one is risk reduction or patient safety. Mainly we need to be, the nursing care has to be given for reduction of the reduce of a risk or the patient safety. Second one is physical optimization. We need to be see the patients of physical, any conditions are there or any medications they are taking, previous medications or past medication, whatever they are having before the thing we need to be give to the patient in a small, because the patient will be started with the NPO before the 8 hours. Okay, before the 8 hours the NPO will be started. Everything we need to be see in a physical optimization. Next one is preventing complications. So we have lots of complication during the surgery and after the surgery. This all we need to be prevent for the preoperative nursing care itself. Next one is psychological preparation. So always the patients will be get more afraid, more afraid for the thing, because they are going there, entering to the operation theater the first time, so they will feel what will be happen, everything. The psychologically the nurses has to be get prepared to the patient. Okay, because the patient is always getting too much fear, afraid. Okay, so psychological, emotional support has to be given. You need to be explain about the surgical procedures, everything you need to be maintain the confidence, means get the confidence from the patient, and the patient has to be feel free of the fear, and they have to be entered into the operation theatre. So the nursing care is psychological preparation, and logistical preparation is nothing but whether the patient is NPO, okay, IV medications are started, IV fluids are started, everything we need to be see in your logistical preparation. So these are all the purpose of preoperative care. So next one is, what are the assessment has to be done in a preoperative care? The first one is review the client's health history and preparation for surgery. So in the health history is nothing but you need to be asked previous history collection, okay, previous histories, what are the histories are there, like a past, present, okay, what are the things has to be taken, what are the medication they have, or allergies are there, everything you need to be checking the review of client's health histories and preparation for surgery. Then review preoperative laboratory and diagnostic studies. So before we are we are entering to the hospital, we are consulting the doctor will be give us certain diagnostic evaluations like CBC, okay, complete blood count, then X-ray, MRI, what kind of conditions, according to the conditions, according to their disease condition, they are started to make the laboratory and diagnostic studies. We need to be check it out, review all the blood tests and MRI scan, endoscopy, whatever the doctor prescribed, everything we need to be check it out whether it is there or not. Otherwise, we have to be send the patient for all the tests. Next, assess physical needs. Assess physical needs means whether the patient will be started with NPO, then urinary elimination, okay, bowel elimination, everything we need to be started, okay, catheterization, IV fluids, we need to be assessed for this. Next, assess psychological needs. As before I said, we need to be start with the emotional support, explain all the procedure to the patient, okay, then confident, we get the confident, everything we need to be get in a, we need to be assess the psychological needs. Then assess the culture needs. We need to be made the cultures, we need to be respect their religious, okay, then we need to be respect their caste, languages, communications, everything we need to be seen in your assessment. Okay, this is all the perioperative assessment. This is the main important assessment in a perioperative nursing care. Okay, this is the first basic things we need to be assess the patient in a preoperative, then we need to be sent to the patient to the OT. So what are the preoperative preparations? Okay, so first one is physical preparation, next one is psychological preparation. As before I said, so physical preparation, first one you need to be check it out whether the patient have a body preparation, okay, whether we need to be check the body preparation. Body preparation is nothing but full shavings, okay, the hair has to be removed in all areas. So that's why we are removing all the body preparation means removing all the hairs means because it is infection, risk of infection. So we are reducing the infection with the help of removal of body hairs. Okay, next NPO. We need to be start with the NPO of 8 hours. Okay, physical preparation, IV lines, positions, then clothing, then medicated bath. This all you need to be done in a preparation of preoperative care. Next one, psychological preparation. As before I said, information, consent, okay, consent you need to be get, then emotional support, cultural support. So everything you need to be doing in a preoperative preparation. So that's all about the preoperative care. Next one is intraoperative care. So intraoperative care is nothing but when your patient undergoes a surgical procedure, beginning when they enter the operating room and ending when they leaving the operating room. So this is nothing but intraoperative. Intra means between, during. Okay, intra means during. During the surgery. during the surgery, what kind of care has to be given. That is called a intraoperative nursing care. Okay, so during the surgery time, we need to be see more cautious. Okay, we have to more cautious to see the patient's conditions. So these are all the purpose of intraoperative. First one is patient safety and monitoring. We need to be see the patient safety, whether the patient is, we are keeping the patient in a proper position, we are having a ECG mission, okay, a ventilator mission, everything we need to be monitored on the time. Intraoperative means during that time the circulating nurses are there, the nurses has to be see all those things, because we have a importance of patient safety, okay, and monitor all the procedures, vital signs, ECG mission, ventilations, everything we need to be check it out. Then surgical execution means correctly the patients are the doctors are doing a surgery or not, because correct site, correct procedure, everything we need to be see. Correct site, correct procedure, correct medications, okay, everything we need to be see. Then real time guidance. Real time guidance is nothing but whether the patient came inside, okay, the patient, the OT time, in and out, you need to be make a correct time, okay, because some procedures will be have a extension, like example bone surgeries, heart surgeries, this all it takes more than the 8 hours. So we need to be maintain the in and out time, because we need to be see the patient's health conditions also. Next, diagnostic and therapeutic action. During the time, during the surgery time, we need some kind of diagnostic evaluations, or we are putting some kind, we are keeping some procedures like a K-wire or some kind of procedure materials is inside, means we need to be see, take a x-ray on the time, whether it is a position or not, ultrasound, everything has to be during the surgery time, we need to be check it out. Then documentation, it is a very important one. During the procedure time, what are the medication given, how much anesthesia given, okay, what anesthesia, it is a whether spinal anesthesia or general anesthesia, everything, the operation notes is must important. The documentation means what? Operation notes, okay, from where to where the incision done, what kind of suture they did, everything you have to be mentioned in a patient's case sheet. Then maintain physiological hemostasis, okay, all the things like a blood clot, whether the blood clot has happened or the bleeding is there, everything you need to be mentioned, okay. If the bleeding is there, means you have to be send a PPT, and you have to send any other condition medicines, or you need to be given any vitamin medicines for arrest the BP, arrest the blood clot. So this all you need to be checking in during the dialysis, okay. These are all the purpose. Next, what are the preparation? Intraoperative time, what are the preparation has to be done by the nurses. So first one is ventilation. Ventilation should be assessed by the continuous auscultation of breath sound, because 8 hours or 5 hours the patients will be in a general anesthesia or spinal anesthesia. So we need to be start with the oxygen and ventilation. You have to be see. That is the first important thing. Then oxygenation, monitor the continuous pulse oximetry, because the patient is getting a hypoxia, the respiratory complications are there, anything we have to be analyzed with the oxygenation with the help of the pulse oximetry. Then ECG monitoring, whether there any changes will be happening in a cardiac, so that also we can make a preparation. Heart rate, BP should be monitored at least 5 minutes, okay. During the time, every 5 minutes to 5 minutes we need to be check it out their heart rate and BP. Monitoring devices like a ECG, electrolytes, pulse oximetry, BP cuff, everything, whether it is present or not, you need to be check it out. Then proper positioning, that is an important one, okay. The patients either supine position or prone position according to their surgical site, okay. Suppose the patients have any spine surgery, they have to be lie down in a, or we have to be positioned in a prone position, okay. Like this, the position we need to be maintained during the time, during the operation time. Next, emergency drugs and tray should be available. Suppose the patient during the surgery time itself, the patient have a cardiac arrest, okay, attack will be happen or arrest will be happen. So that time we need to be keep a emergency drug always in a OT. The emergency drug has to be present. Okay, that preparation has to be done by the nurses. Defibrillator, okay, defibrillator also should be available over there. Then accurate count of sponges, instrument sharps that maybe become a foreign bodies. We need to be, during the surgery time, the surgical nurses, okay, scrub nurses has to be tell how much they will explain, okay, how much cloth will be there, how much sponge will be there, because during the surgery time we need to be wipe the blood, okay, they need to be make a count of sponges, otherwise they will keep inside and they will stitch. Okay, that all the count has to be taken by the circulatory nurses. Okay, instruments, what are the instruments, how many instruments you took, that all you need to be thoroughly count and keep, and when the surgical procedure done, you need to be count, same count will be there or not, you have to be check it out, because it will be, should not be become a foreign bodies of their patient's body. Then strict aseptic technique, okay, always we need to be go for the aseptic technique, because as a nurse we need to be use a aseptic technique, hand washing, gloves, gown, all the PPE with the hand washing technique we need to be do, because we are going to inside means we have to be giving a care of the patient, so we need to be reduce the risk factors. Okay, so aseptic technique has to be maintained. Same thing, sterile gloves, gown, okay, for using for the procedure. Then skin preparation, already I informed to you, skin preparation, body preparation is very mandatory, because this small bit of hair or small bit of skin things will be there, means it will be get infection to the patient. So this all this we need to be see in a intraoperative time. Okay, what are the complications will be taken over the intraoperative? As already I informed you. So cardiovascular complications. Cardiovascular complication is nothing but arrest, cardiac arrest will be happen. Okay, cardiac arrest will be happen. We are, however, we are doing a certain procedure also, sometimes the patients will be get complications. So that is a main important complication is cardiovascular complication. Next, injuries. Injuries means when we are using a catheter. Okay, urinary catheter, what will be happen? The UTI will be take place. Nerve injury, we are making an incision of a nerves or the blood vessels, small blood vessels is there in our body. Okay, so that also nerve injuries will be take place. Next, respiratory complication, hypoxia. Okay, the beep what will be happen means the respiratory that saturation will be get drop, oxygen level will be drop, so respiratory complication, hypoxia will be take place. Next one is hemorrhage, that is a main important one of intraoperative complications, because whenever we are using a incision, what will be happen, the blood bleeding will be take place. So these are all the main important complications of intraoperative time, so we need to be take care of this complications. So that's all about the intraoperative nursing care. Next one is postoperative care. Postoperative care is nothing but it is a specialized medical, nursing and rehabilitative care patients are receiving immediately after surgery until full recovery. Okay, so once preoperative means what? From the admission to they are entering into the operation theater, the nurses has to be giving a care. Intraoperative means from the OT to recovery area. Okay, recovery area, whatever the nursing care has to be given, how we need to be given the nursing care. This is a intraoperative. Postoperative means what? After the surgery, okay, after once they are shifted from the recovery to recovery room to the post-op room, okay, post-operative room, until their full recovery, until their wound heals, until they are came out from the unconsciousness, until they are getting an ambulation, everything after the full recovery, the nurses has to be given nursing care to the patient. That is called post-operative care. It aims, what are the aims of post-operative care? First one, manage the pain. Next, prevent complication like an infection, blood clots, like that. Then ensure proper wound healing. We need to be ensure the proper wound healing. So this all includes monitor vital signs, wound care, medication management and early ambulation or mobilization is called a post-operative nursing care. So here there is a purpose of post-operative care. First one is preventing complications. So bleeding or any kind of complications we need to be prevent. Pain management. Okay, if the patient is saying a pain, over pain, we are giving a certain medication like a tramadol or means diclofenac or dolo, which is doctor prescription. According to the doctor prescription, we need to be given pain management. So pain management have a pharmacological pain management and non-pharmacological pain management. Okay, so this all one classes like a wound care, pain management, ambulation. This all I will discuss in a later classes. Okay, so here just I am giving a brief explanation about the pharmacological and non-pharmacological pain management. Pharmacological means related to medications. Related to what? Medications. Like as before I said, according to the doctor's order only, what we need to be give? We need to be give a medication to the patient. Non-pharmacological. Non-pharmacological means we have different types of non-pharmacological pain management, like diversion therapy. We have to go for the music therapies like that. Then hot application, cold application. Okay, then massage. So this all will be taken for the non-pharmacological pain management. Okay, so that also we need to be think what kind of condition, what kind of patient has a condition. According to that, we need to be given pain management. Next one is wound care. So suppose if the patient have a wound, okay, the incision is there in a abdomen or in a back. Okay, so we need to be give a proper wound care of the patient. Okay, because if anything has happened, so it will be take for the SSI also. If you're not giving a proper wound care, okay, with the aseptic method, if you're not giving, what will be happen? SSI, okay, surgical site infection. What is meant by surgical site infection is the surgical site infection within the 30 days, within the 30 days, okay, after the surgery. Suppose example 20th March, they are done the surgery, means from the 20th March to 20th April, in between of these two dates, something oozing, okay, or any discharges or swelling or redness, anything is seen in a surgical site, that is called surgical site infection. So we should take care of the wound until their recovery. Okay, it should not be happen. This is also one kind of a complications of postoperative type. Then early ambulation after the surgery, example cesarean section or some kind of a small hemorrhoidectomy or any kind of appendectomy. Immediately next day itself, what we can do, we can tell the patient for mobilize, for sitting, for just walking in a two-step, because lots of blood supply has to be taken place and the wound healing will be take place as soon as possible. So early ambulation or early mobilization is very important for the patient. Otherwise what will be happen means the patient will be get DVT or the patient will be get some kind of compartment syndrome. This all will be take place. Okay, DVT means deep vein thrombosis. If the patient is not mobilizing their legs or their body, what will be happen? Their small blood clots will be taken place and it will be leads to DVT. Compartment syndrome, if they are not mobilizing properly, it will be contract. The body areas will be get more contraction. Then after that, the patient will not get proper walking or proper movement in their body. So before this all we need to be prevent, what we have to do? We need to be do the ambulation. Then support and education. It is a main important thing, because after the surgery, the patient will never change their position. They will sit like, because they have a pain. Yes, but for that, what we need to be do? We need to be do the support. Okay, no problem, ma'am. We will take care. The physiotherapist is there, nurses are there, so everyone is there. So they will take care of you. So please come for the ambulation. Like this, you need to be make a more support, psychological support, education. Before the surgery itself, you need to be start their education. Okay, then only they can accept and they can do their physical activities. Okay, so these are all the purpose of postoperative care. Okay, so this is a main important of nursing care. Next one is postoperative preparations. What kind of care has to be given? Okay, as a nurse, what kind of care? So here we have two types of care. One is immediate and late. Okay, so in immediate, initial assessment. after initial, once the patient is came from the recovery room to the post-operative, first we need to be see the airway patency, whether the patient have a ET tube. Okay, we need to be check it out. After the recovery, after the patient came from the consciousness in the recovery room itself, the patient came from the consciousness, immediately the patient will be shifted to the post-operative ward. So we need to be check the ET tube, whether the patient have a proper patency of airway. Okay, the connection, the lines will be placed in a proper way. This all you need to be check it out. Then effectiveness of respiration, you need to be check it out their respiratory rate, whether the patient have a proper respiratory rate or any aspirations, everything you need to be check it out. Okay, as a nurse we need to be see this all assessment has to be done. Presence of artificial airway, as before I said, CPAP, okay, BPAP or ET tube or oxygen administration, everything you need to be check it out. Okay, whether it is present or not. So documentation is very important. Mechanical ventilation or supplemental oxygen has to be check it out. Circulatory status, okay, ECG or any kind of monitors, BP, everything you need to be check it out for the initial assessment. Initially you need to be do this all those things. Vital signs, very important, because whenever we are studying the nursing, the main important thing is vital signs, because here temperature we can check, respiratory we can check, pulse, pain, okay, SpO2, everything we need to be check it out in the initial assessment. Then wound condition, okay, once the patient after the 8 hours or after the 6 hours they are coming from the recovery room, immediately you need to be check the wound condition, okay, whether the oozings are there or whether the bleeding presence are there or soaked or not, everything you need to be check it out in a wound area. Okay, the wound area soaking is nothing but full of discharge will be happen after the surgery. The drainage tubes will be present or not. Everything including dressing and drains, you have to be check it out. Don't forget to check the wound condition after receiving the patient from the OT. Fluid balance, IV line, okay, IV line, how much fluids has to be given, everything you need to be check it out. Especially monitor the IO chart, intake and output chart, how much you are giving, how much the urine output, everything initially you need to be check it out. Then level of consciousness, whether the patient have a consciousness or not, okay, so you need to be check it out. Pain, okay, with the help of pain scale, like a visual analog scale or numerical scale, you need to be check it out the pain level, and according to that you need to be give the medication as per doctor's order. So this all the initial assessment. Once you are receiving the patient from the recovery room or the OT, immediately you need to be check it this all the assessment. This is the main important nursing care after the surgeries. Okay, next one is later post-operative care. Once ongoing assessment, once they are coming, one day is over, okay, one day initially we are checked everything, then ongoing what kind of assessment has to be, or ongoing what the nursing care has to be given. Respiratory function, you need to be check it out. Okay, so doctor if saying ET tube has to be extubated, means immediately you need to be started with extubation. Okay, directly you don't take the ET tube, okay, you need to be reduce the FiO2 and you need to be started to extubate the ET tube. Okay, then you need to be give a CPAP, or according to the patient condition you need to be give a respiratory function. Then general condition as usual, wound care. Okay, then whether the patient's body conditions like a bed path, everything has to be given on the time. Vital signs, cardiovascular function, you have to be check it out the ECG every day, okay, because the cardiovascular function has to be check it out. Fluid status, because IO chart, okay, intake output chart, because if you are not maintaining fluid status properly, the patient will be leads to renal failure. That is very worst nursing care. Okay, so if you are giving a proper fluid status of your patient, you can recover from the renal failure. Okay, so you need to be maintain the fluid status. Then pain level as usual. The pain level, if the patient have a 0 out of 10, if the patient have a 3 or 4, you have to go for non-pharmacological pain management. Okay, if they are having a severe pain, you have to be informed to the doctor and they can give a medication. Then bowel and urinary elimination. After the surgery, the first day they can't pass the stool. Okay, so immediately you need to be checked bowel flatulence. Okay, because the flatulence, if it is relieved, the patient can easily walk, they can easily pass the motion. Okay, then urinary elimination, you have to be see the catheter. Okay, immediately if the catheter will be filled 3/4, immediately you have to inform to the people to change the uh, elimination urinary pattern. Then dressing, tubes, drains, IV lines, everything you need to be checked. This all ongoing assessment. Okay, first day, second day, third day, until the patient can recovery from the operation, the post-operative time. Okay, 4 days or 5 days, you have to be the post-operative nurses only has to be recover the patient in a normal life. Then they can shift it to the normal ward. Okay, so these are all the ongoing assessment. Okay, these are the post-operative care. Next one is post-operative complication. These are the last portions which we are studying. Post-operative complication: hemorrhage, shock, aspiration, SSI. Okay, here I gave the few complication only. SSI. Okay, then other general conditions. If you are not properly seeing a aseptic technique or some kind of things, the patient will be go others general condition, general complications will be take place. Infections, okay, DVT, this all will be taken place in a post-operative complications. So we have to be recover from the patient or prevent from the complication, means we as a nurse, we need to be give a proper care after the surgery. Okay, that is the main important thing. Before the surgery also main only, but there we are making a patient in a preparations. Okay, whether the patients are having a certain medications or they are having a certain blood test, everything we are check it out and we are sending to the patient into the OT. From the OT, we are monitoring the keen observe should be there in an intraoperative time. After the post-operative time, we need to be prevent all the complication like SSI, hemorrhage, anaphylactic shock, aspiration, infection, DVT, everything we need to be prevent as the nursing due to the nursing care. Okay, so these are all the complications. So I hope you all understand about the perioperative care. Okay, thank you. So this online class will be now, the EasyNurse app will be have an offer in all courses 1500. We can take and we can make the classes in online for BSc, post BSc, GNM and MSc also. So online tuition also is there in a EasyNurse app. If you have any admissions, please contact in this number. Thank you.